Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives, here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel that you are stuck in a dark place, I want to tell you, don't give up. There is a light at the end of the tunnel for you too. Today, I'm extremely pleased to be with Fanny Atomsa. She's a registered massage therapist, birth doula, as well as owner of Blue Nile Massage and Wellness. Welcome to the show.
Thank you, Doc.
Now, you told me before the show that I could call you Fanny. Is that right?
Yes.
Fanny?
Fanny is perfect. That's what most people know me as. No, Fanny. Fanny or Fanny, whichever.
No. So today is part one of a two-part mini-series with you. Today I'd love to hear your story, and in the second half talk about your approach to massage therapy.
Yeah.
And in the second show, in a few weeks, we'll explore what a birth doula is and how she can help mother and child have a great pregnancy, birth, and beyond.
Absolutely.
So tell us a little bit about where you come from, how you arrived in Canada. Blue Nile shows a little bit that you may be from Africa?
Yes, of course. Proud to be from Africa. I was born actually in Sudan.
Oh, wow.
But my parents are from Ethiopia, so my heritage is Ethiopian. And we actually came to Halifax in 91, so I grew up here. And I recently got into massage therapy, so I've been doing it for 2 years. And I recently started my own business, so it's been in operation for about a year now. And I recently took over the name Blue Nile, which is very personal to me, of course, being Ethiopian and East African, and just with the pride that I have there. And as well as that, I wanted something to represent where my vision was and where I want to go. So
now let me ask you a question. I'm a very curious person. Most people, when they think of the Nile, think of a muddy river in Egypt.
Right.
Now the Nile, I think, is a very long river, isn't it?
It is, yeah.
So it is all in Ethiopia. Is it in Sudan too?
Yeah, it crosses through Ethiopia, Sudan, Egypt, and I believe even parts of Uganda. So it's, it's a source of life for people and animals, and it's been the center of life and in the center of the world, Africa, of course.
For thousands of years.
Yes, millions.
Many people say we actually come all from Africa.
Absolutely.
Cecil, our producer, says, yes, we all originate in Africa.
Yeah, absolutely.
Some of us got a little lighter skin tone over time and some didn't, but we're all the same.
Yeah, exactly.
Exactly. So that's fun because many people have not much idea about, I would say, anatomy or the geography of Africa.
Right.
And of course, many people here are Christians, so they remember the biblical story of Moses in the Nile River.
That's right.
Is the Nile River actually blue where you come from?
Well, water is not blue anyway. But, when you think of water, you think of blue. It's a calming thing. But it's very powerful. I mean, it turns into waterfalls. It's huge. A lot of people use it for nourishment. There's a lot of talk around it right now, I believe. I don't know much about the politics, but Ethiopia is just trying to build a dam and this and that, but that's not part of what I'm involved in.
No. We are fortunate here in Canada. We have lots of fresh water, but fresh water, as you said, is a source of life.
Absolutely.
And if we have no water, we starve in a few days.
That's right, exactly.
We can not eat for many, many days, but we have to breathe. We cannot breathe for 3 minutes, and we cannot drink maybe for a week.
Right.
So, and down in Egypt, what most people think about, and probably Ethiopia, it's quite hot.
Oh, yes, definitely. 13 months of sunshine.
Wow.
We have 13 months in Ethiopia in the Orthodox religion,
Yeah. So tell me a little bit about how you grew up. How did it look? How you grew up in Halifax? How your parents grew up?
Yeah, so we, of course, were immigrants. So we were landed immigrants. My parents worked very hard because, any education that you have, of course, is not recognized once you come here. So my dad, worked at Kent Building Supplies for many, many years. Now he drives taxi. My mom was always a caregiver. So, I grew up watching them work hard. We grew up in the north end of Halifax, so a lot of diversity, very, very heavy in culture there.
Now, it wasn't long ago because you're still a young woman.
Yeah.
But my now husband, my Haligonian husband, as I call him, he grew up in the North End too, Derby Street. But it was 60 years ago, so you weren't even here then.
No, but it's still, you still get a homey feel when you're around there. It's a very, very large community, very close-knit community. So we grew up there, and I went through all, school here. I never moved away. I've just been in HRM the entire time. Yeah, absolutely.
Do you have siblings?
I do. Yeah, I have 2 older brothers, both of them who are here, and I have a younger sister who's in Toronto.
Oh, so, wow, big family. Now, question for you.
Absolutely.
Why are you passionate about massage therapy, doula, and wellness generally?
Yeah, as I mentioned, my mom was a caregiver, and I think, having a younger sister and then, nieces and nephews, I've always been interested in caregiving and the caregiving role. I thought I was going to become a social worker, but life kind of took me towards health.
Tell me about that. How did that happen?
Yeah, I was actually waiting to be accepted into a social work program, and then I needed something. I was out of school for a while, and I felt like I was ready to go back. And I was interested in alternative health, and my friend had just finished the massage therapy program, so she recommended it to me, and so I took it, and I absolutely fell in love with it. Yeah.
I find it really funny that we here consider massage therapy alternative health, because I come from Germany. Massage therapy, you can get it on prescription.
Yeah.
It is part of the health system, as well as hot packs, because we know it works.
Right. Yeah.
Yeah, so it is really fascinating what we here call alternative, what is still seems like everything that's not just pills and surgery is alternative here.
Yeah, exactly. That's, I guess that's more conventional, or those are the types.
That's a conventional medicine, pills and surgery, and it's sad. There's so much more to it, and I'm fortunate in Germany. I was both a conventional and naturopath. Right. So I'm really on both sides. I appreciate conventional medicine, but the more chronic your disease is, the more you need a different approach.
Definitely. And preventative health is a big thing in terms of managing your overall health long term. That's why, massage therapy and any type of holistic health approach is really valuable. And the maintenance plan, which is something that we've talked about for a long time, that's also very important.
Yeah, for me, I see it like when people see still health as something that happens to them, or sickness, something that happens to them. But I personally think we need to plan for our health.
Absolutely.
And like building a house, you plan with it with an architect. And the same, when we build for our health, we should have a good plan.
Right.
That's what I like to do. I like to make the plans for people to get well or for people to keep well.
Absolutely.
And massage therapy is a great thing. And we'll talk in the second half more about the details of that.
Yeah.
Now, how long did it take you to become a massage therapist?
Well, I chose the 2-year program so that, I got a nice summer break in between. And
it's quite intense, isn't it?
Oh, it's very intensive. Anatomy, physiology, neurology, pathophysiology, everything. Yeah, absolutely.
And you have to strengthen your arm muscles because it is quite strenuous if you don't want to just pet the people by massage.
Exactly. You build up an endurance over time.
Now, a curious question again. Does your massage sometimes get confused with non-medical massage, let's say? That's erotic massage, what they call?
Yeah, we still...
You give calls from those people that say, can you massage my private area or whatever?
That's still... exactly.
That?
People have used our title, unfortunately, offering other services. So we always get those questions here and there. And especially where Nova Scotia is not regulated, massage therapy is not regulated here as a profession.
That's a problem.
That's a big issue for us, not only us but also the public. So
it's for the patients too, because they don't know if somebody is really educated for it. And the second effect that it has, and I worked at H&R Block, shouldn't have said, I did some taxes for a while, and I know that you can't deduct massage therapy from your taxes in Nova Scotia because it's not regulated.
Yeah.
So hey, regulate it. We want to deduct the cost because it's worth it.
It is, and most insurance companies recognize us, and doctors recognize us.
Therapeutic massage is great, and I myself have a massage every month or so.
Okay, you have to come see me now.
Yeah, I have to try that. I love the massages.
Yeah, there you go.
It is not just relaxing; it has many more benefits,
Absolutely.
and we'll talk about that some more.
Of course.
And it is really fascinating. And in the second half, we'll go into the benefits of massage, the dangers of massage, how often you should massage. So make sure to stay for the second half of this show on 97.5 CIOE FM Community Radio. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm talking with Fanny Tomza about her story and massage therapy. It's part one of a 2-part series. In a few weeks, we'll be talking about what she does as a doula, which is fascinating. Now tell me a little bit about what you love in massage therapy, what it really is, and what types there are. We already said it's not erotic, it's therapeutic massage. So that's an important distinguishing.
That's number one, exactly.
And all the clients or patients should look for a therapeutic massage.
Right. Yeah, absolutely. For me, there's 2 main parts to massage therapy. There's the clinical scientific part of massage therapy, which of course, it reduces muscle tension, helps to decrease sympathetic nervous system firing, helps you to relax. Including with massage therapy, we do manipulate muscles, but at the same time, we encourage joint nutrition. We encourage range of motion. We help you recover. It's rehabilitative. We can rate letters to insurance companies if you've been in car accidents. There's that side of it, which is wonderful, and the science really backs it up. And then there's the healing, more energetic side of massage therapy, which is, the emotional, the mental benefits of massage for stress reduction for people who have experienced trauma, introducing positive touch again. prenatal massages, focusing on energy rebalancing, opening up the body and the mind to new ideas and new ways of functioning. There's both sides there.
I always find that for some people, especially those that are single, massage therapy can be a safe way of receiving therapeutic touch.
Absolutely.
And I saw on TV, I don't know if you've seen that on the news, that they now started actually as a business, somebody just touching people. Mm-hmm. They invite them in their bedroom, they're fully closed, and they touch them.
Yeah.
And they cuddle.
Okay.
Which sounds interesting, but I don't know. That is certainly not regulated, and I would be a little skeptical about that. I'd rather have a good therapeutic massage.
Sure, yeah.
And can you adjust your pressure to what's most important?
Absolutely, yeah. Some people prefer deep tissue, which I offer.
Is that what hurts?
I suppose, yeah. Some people have different thresholds for pain. You know, what might hurt for some person might be therapeutic for another person. So for that, a lot of long, deep holds for my deep tissue massages, a lot of elbow work. And then,
that's what dissolves those knots
Absolutely.
That people often feel, and that causes neck pain or shoulder pain or back pain, headaches, all that, right?
Those types of things, exactly. Repetitive strain injuries where your muscle is just under so much pressure that it tightens and it's not able to release for a long period of time.
Now, tell a little bit about the anatomy of really, for example, an arm. Many people have no idea that there's not just muscles in that.
Absolutely, yeah. There's many muscles in. We can divide it into the forearm. The whole arm there's many muscles. In the forearm, you have muscles on both sides. You have muscles on the front and on the back, and they help your wrist to bend. A lot of people don't realize that sometimes pain that they're experiencing in their hands is coming from the forearms. We can develop trigger points. People who use their hands a lot, carpenters, people in labor industry, it's repetitive strain on these muscles. And we have ligaments in there. We have fascia that surrounds the muscles and divides it into compartments. We have bone.
So the fascia allows the muscles to glide against each other so they don't stick together.
Yeah, that's an ideal fascial world.
So with massage, do you release fascial adhesions?
We can. We certainly can. Something that I love to do is cupping. Cupping is great for fascial release because the fascia is really designed. If you've ever seen, what fascia looks like, you must know.
Sure.
It's that thin, filmy stuff that you might see around chicken. It looks kind of like saran wrap. That's what fascia is, and so that can get really balled up. So cupping is another great thing to kind of loosen that so that we can address the muscle underneath.
Yeah, that's wonderful. And many people don't know that muscles are attached to the bones by something called tendons.
That's right.
And the tendons, they actually go directly into the muscles and the fascia. So it's really fascinating, the anatomy. And I personally am a Tai Chi enthusiast.
Oh, nice.
And we talk a lot about spine turning and fascia, but there's more in the arm. There's blood vessels, there's lymph vessels, there's nerves, and they all have to be turned and squeezed and released.
And decompressed, absolutely.
And a massage therapy can be such a great help.
Yeah. A lot of, for nerve pain, muscular pain.
Even carpal tunnel is worth a trial.
Carpal tunnel.
And I had ulnar syndrome, and my neurologist sent me for surgery. At that point, I didn't know that massage therapy could resolve it. So I had surgery, it didn't help.
Oh, wow.
And now on the left side, I had it too. It didn't. They wanted to do surgery too, and I said, no, it didn't help on the right side. Why should I do it on the left side? Doesn't make sense.
Yeah.
So I went to massage therapy. The left side is good.
Great.
So massage therapy can be of great value before you decide to have a surgery like carpal tunnel or ulnar decompression.
Right. Yeah, I agree. Yeah, absolutely.
And I mean, you can still have your surgery if it didn't help.
Exactly. We're not ruling out surgery. There's definitely times when medical intervention is necessary. But, it's nice to just try non-invasive first and see if you're able to facilitate your own healing. Otherwise, of course, we do need our doctors around.
Absolutely. I love conventional medicine too, as well as what we call here alternative medicine. In Germany, it's the same.
It's just medicine.
It's just medicine.
Isn't that amazing?
I had actually a specialty as naturopathic medical doctor. It's just one medical doctor that looks at the whole person there and prescribes herbs. You can prescribe them on the health insurance.
That's amazing.
Herbs and massage therapy and heat therapy, and it's so necessary.
Right.
And it helps.
Yeah.
We should do it here.
Yeah.
But there's a lot that doesn't work the way we would wish. So at the moment, in Canada and in the US, we have to pay for massage therapy, which for some people is a hurdle if they don't have additional insurance.
Definitely.
And some people also are a little bit ashamed of getting undressed.
Oh, yeah. Absolutely.
What do you do in this case?
I always encourage people. I give them their autonomy first and foremost, especially if it's their first time. You really only undress to your comfort level. Obviously, skin-to-skin contact is the best, but if you're not able to undress fully because you're not comfortable, there's lots we can do through the clothes. So I don't want that to ever be a barrier. I don't want anyone to feel uncomfortable because of that, because we can always find ways to work around that. Absolutely.
And I think what you mentioned first, the energy transfer works through the clothes just as well.
Absolutely, yep.
Because some people call it aura or the energy body of the body or the acupuncture energy system. I believe it's all the same.
Yeah.
And there is something that we don't know much about, and it's fascinating. And massage therapy definitely helps with that.
Yeah, combines both worlds.
Super, super. Now, before we come to the end of the show, I would like you to share how people can contact you, where you're located, and how can they contact you.
Absolutely. I'm on social media, on Instagram. You can find me at bluenile.massagetherapy. Facebook, same thing, Blue Nile Massage and Wellness. And my website is www.bluenilemassagetherapy.com. You can book online, check out my services.
Cool. Now, do me a favor and spell that for the listeners that didn't get it the first time.
All right. Blue Nile, B-L-U-E, Nile, N-I-L-E, Massage and Wellness. Should I spell massage and wellness?
So it's Blue Nile Massage and Wellness.
Exactly.
.ca.
No.
.com?
Sorry, Blue Nile Massage and Wellness.
Blue Nile Massage and Wellness.
That's me on Facebook.
Yeah.
And then on Instagram, I'm Blue Nile, BLUENILE .massage therapy.
Okay. And your website?
My website is bluenilemassagetherapy.com.
.com. Wonderful. Thank you so much for that.
Thank
and
you.
we'll, of course, share it on the podcast site where it will be later. Thank you so much for being on the show and giving us a little bit more of insight about wellness, natural wellness, massage therapy. Always a solution that you should think about before you have surgery or before you just give up.
Absolutely.
And suffer from headaches forever. If you had an accident and have to recover, that is a good option. So thank you so much for being on the show.
Thank you so much.
And this brings me to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Fanny and forgot a website, I'll be happy to help you. My email here is christine@communityradio.ca, or you can contact me through my website docchristine.com. And I'm always grateful for feedback. I also want to extend a special thank you to today's producer, Cecil Wright. You're the best. You may not know this, but this is a volunteer-run non-profit radio station. And we even have an art gallery. If you're local and you like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE-FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.